So, I think it would be useful if we started by your telling me something about your state of mind at the moment. How would you describe it? Would you say you were happy or depressed, confident or unsure of yourself? What words would you use to describe your mood, would you say? Take your time.
Fascinating, absolutely fascinating. Your problem seems to center around the delusion that you are a psychiatrist. And that everyone you speak to is a patient of some sort. This is a rare but not unheard of syndrome.
I think perhaps it'd be helpful now if we talked a little bit about your mother. What are your feelings towards your mother?
Extraordinary, really very intriguing. Now, why mother? Was your mother affectionate towards you when you were small?
Affection. Affection, that's interesting. I wonder why you chose that word particularly. I think it would be helpful if you told me at this point, if you can remember, whether or not you were breastfed as an infant.
Already you see we're focusing in on breasts. Good, good. Now, how do you feel about breasts now? Do they frighten you? Because again, this is quite common.
Breasts and fear. Oh, now that is very interesting. Breasts and fear. Fascinating association. Where do you think your father fits into that association?
Right. Absolutely classic father. All right, so let's imagine a line, shall we? We have fear at one end, breasts at the other. Now, where would you place your father on that line?
Lines. Lines. Now, that is interesting. I may ask you to draw those lines in a minute in something we call a Bender Gestalt test, which can be very revealing. But lines, let's explore those for a moment. They're very penetrative, aren't they? Very, very thrusting, very male, very masculine. They urge onwards, don't they?
Right. So now, at last, the layers are beginning to unpeel. This is very important. So we have breasts, we have fear, we have male, thrusting, penetrative, urging, some sort of psychiatric jargon you've picked up from the Reader's Digest. How often would you say you masturbated?
Now, I'm going to be really quite firm now, all right? I'm the doctor, you are the patient.
Yes, that's right.
Now, I'm sorry, I want to hear you say it. I want to hear you say, I am the patient.
What was that?
I am the patient.
Good, good. That's a breakthrough. Now that you can say that, now that you can admit it, we can proceed. Excellent.
You are the patient.
I am, you are. Perhaps we're all patients.
No, I am not a patient.
Now, please remain calm, Mr. Windrush.
Dr. Windrush.
Now, you realize that I only have to lift this phone. You will be restrained.
Yes, hello?
Yes, it's all right,
don't
Rebecca.
worry,
I'm in a
thank you,
session.
Rebecca. We're in the middle of a
Just a
session.
patient. Don't worry about
There's
it.
nothing to
Things
worry
go.
about.
Now, look, I can't help you unless you stop playing this ridiculous game.
Extraordinary. I don't think I've ever come across a more deeply embedded illusion.
It is not an illusion.
Your last doctor tried you on a course of lentisol, I believe. Did you find that helped at all?
All right, let's go right back to the beginning, shall we? If you are, as you think, a doctor.
Well, I'm sorry. That's the full hour, Mr. Windrush. Should we say same time next week?
Yes, I think I can fit you in same time next week. Perhaps for the next session you could bring some photographs of your parents. That might be useful.
Yes, I think I might try you on a course of hypnosis next time.
And if you'll just confirm that appointment with Rebecca on the way out. Thank you.
Oh, you're both here. Well, I think I'm seeing you first, Mr. Windrush. Would you mind waiting outside, Mr. Johansson? You're a little bit early. Rebecca, 2 teas, please.
Extraordinary.
So deep-seated.
Simply fascinating. Well, now,
Do sit
Mrs.
down,
Medlicott,
Mrs. Medlicott.
please
Mr.
take a
Johansson
seat.
is just on his way out. I've
Windrush is on
finished
his
my
way
session
out.
with him.